The name of the article is a premolar transplantation to replace a missing central incisor. This case report is about a 10-year-old boy who was missing a maxillary central incisor, which had been lost in a traumatic injury at the age of 8. Consequently, treatment becomes limited because it's contraindicated to place dental implants or other restorative treatment while the patient still has the potential for alveolar growth. From the clinical point of view, the boy was physically healthy but had active caries and decay reaching the pulp of maxillary right first premolar. In addition, he presents a posterior crossbite crowding in the mandibular arc with a discrepancy of 8 mm, a angle class 1 malocclusion, and a class 2 skeletal pterygium. The chosen treatment consisted of extraction of the maxillary first premolar and maxillary expansion. In addition, it was assembled a mechanical orthodontic treatment to make space, the transplant of the mandibular right second premolar to the maxillary right central incisor region. Since this tooth had the ideal apical development for this transplant, because the maxillary right central incisor had been lost, the bony edge was reabsorbed and quite constricted in buccolingual thickness. Surgery with drills was performed to yield one socket to receive the self-transplanted premolar. The second premolar tooth from the mandibular was extracted carefully, so as not damaged the structure of periodontal ligament. After place gently the tooth in infraocclusion to place of the lost incisor, the patient was instructed to avoid any pressure to prevent injury to the periodontal. The gingiva covering the element was stabilized only with a suture to hold it in a position. Orthodontic treatment was conducted 6 months after the surgery to align, level the teeth, and closure the areas of distraction. During treatment, the radiography was conducted showing the success of orthodontic and transplant treatment. In the end of the treatment, a CT scan suggested that cortical bone had been formed by the position of bone above the root of the transplant tooth. The new bone formation was possible only because of the preservation of the cemental and periodontal ligament of the transplant tooth. The treatment is considered a success because it allows a normal vertical growth if the patients come to lose the tooth by resorption replacement process. The bone in the region has been preserved, enabling the installation of a future implant if it's necessary.